Welcome to another episode of our Keep It Simple series where we talk about common neurological problems in a simple and easy to understand manner. My name is Dr. Jay Lin, and today we'll be talking about prostate cancer. Now, prostate cancer is one of the biggest field in the field of urology, if not the biggest. And prostate cancer, according to the Singapore Cancer Society, is the second most common cause of cancer found in Singaporean men between 2014 and 2019. In terms of cause of death, it is actually the sixth most common cause of death among Singaporean men within the same period as well. Now, prostate cancer is usually detected through a rise in PSA levels. PSA stands for prostate-specific antigen, and it's actually a protein found in prostate cells as well as cancerous prostate cells as well. There are many reasons as to why PSA can be elevated in someone. Some of the causes can be fairly harmless, like just aging, a big prostate infection, and naturally, cancer is one of them. In addition, there are medications that we take that can actually artificially press it down as well. Today, we'll be looking at some of the investigation that I will do if someone comes to me with elevated PSA, and we will look deep into understanding about prostate biopsy, which is a procedure that is done to investigate why PSA is elevated in someone. So follow me, let's go.
So some of the topics that we will be covering today will be to explain a little more about prostate cancer, how common it is as a cancer for Singaporean men and how it potentially can affect you. And then we will cover a bit about prostate-specific antigen or PSA. An elevated PSA is one of the commonest reasons as to why patients will come and see me for clarification on whether they have prostate cancer or not. The other reason being abnormal digital rectal examination, which I will also cover a bit more in that chapter. We will then move on to investigations that we will normally do as part of our workup for elevated PSA. The gold standard of finding out what is the cause of a PSA rise is a prostate biopsy, and I'll be going through there. And finally, we will end off with the various complications that can potentially happen when you undergo a procedure for prostate biopsy. As I've previously mentioned, prostate cancer is one of the biggest topic in the field of urology and is a big concern for urologists like myself. In terms of the numbers, nearly 6,000 men was affected and diagnosed with prostate cancer, and these are figures provided by the Singapore Cancer Society. Now, in terms of the cause of death, it's actually the sixth most common cause of mortality among Singaporean men. There is a bit of a disparity. You'll be asking me, hey doctor, why is it the second commonest cancer but only sixth higher cause of death? And that is because prostate cancer is unlike most other cancers. Okay, it's actually a very slow growing cancer. That's the number one thing that I always tell my patient. And the second important thing to remember prostate cancer is that not all prostate cancer will eventually lead to death. Number one, a slow growing cancer. Number two, not all prostate cancer needs to be treated. And as what the saying goes in the field of urology, some patients actually die with prostate cancer and don't die from prostate cancer. That's actually a very important take-home message that I always have when I talk to my patients about prostate cancer and what potentially can it means to you. Now, PSA stands for prostate-specific antigen, and is actually a protein that is found in both normal and abnormal prostatic tissue. The use of PSA to monitor prostate health is probably the commonest way that urologists and general practitioners use everywhere in the world, and is basically a quick and easy way to let us know the health of your prostate. It is expressed in terms in the fields of nanogram per deciliter. No acceptable normal value of PSA in the international community, but commonly the values of 4 nanogram per deciliters is acceptable as a threshold for general okay prostate health. Of course, the younger you are, the value of 4 doesn't necessarily apply to you. One of the common questions that I always get asked is that what does it mean if it's less than 4, and what does it mean it is above 4? So the important thing here is to remember that it is basically a range of values of PSA that doctors all over the world use to gauge the risk of you having prostate cancer. Someone who has a threshold or PSA value of less than 4 does not necessarily mean that he has no prostate cancer. Conversely, if you have PSA values of above 4, it doesn't necessarily mean that you definitely have prostate cancer as well. In terms of using PSA as a marker for screening and for prostate cancer, it is something that is fairly controversial, and basically there are certain international guidelines that do not recommend the use of PSA as a screening tool, unlike other cancers like colorectal cancers and breast cancer, whereby there are fixed national screening programs available for these conditions. Now, some of the causes as to why PSA can be elevated in men could be because simply of age related. Because PSA is a protein secreted by normal prostatic tissue, as we age, prostate will tend to grow bigger in size as well. And the more prostate tissues you have means that your PSA values could be higher as well. One big reason as to why PSA can be elevated temporarily is basically due to inflammation of the prostate. Now, when you have prostatitis, inflammation of the surrounding tissue in the prostate occurs. PSA is released more into the bloodstream, and you have a rise that is mostly temporarily. Once the infection is under control with medication, the PSA usually drops down, and that's also a sign that is actually a very reassuring sign, because prostate cancer related PSA rise, they do not ever go down. They only get higher and higher over a trend of time. Another common cause PSA high could be due to big prostate. The bigger the prostate, the more PSA is secreted into the bloodstream, and you get a higher value. Last but not least on the list is cancers. Prostate cancers, as we mentioned, is one of the most important cause that we need to ensure, or rather what we normally call we need to rule out. In early cancers, the PSA rise fairly slowly, but as the cancer stage progress, we are expecting to see hundreds in terms of the PSA values, and sometimes even up to thousands when it actually spreads to the rest of the parts of the body as well. When a patient comes to me with a result of elevated PSA, if you were to look back, it's usually because of some health screening test or annual checkup test that they do, and they found that they have PSA. Most of the time, they actually do not have any symptoms related to the prostate itself. As part of the workup that we do here would definitely be a detailed history taking, and that's followed by a physical examination. A digital rectal examination, or what we call PR, per rectal examination, is a very common part of the workout to basically discover prostate cancer. A lot of prostate cancers occurs in the peripheral zone of the prostate, and the easiest way to actually approach that part of the prostate would be to go through the rectum. What happens during a visit for elevated PSA is urologists would then basically do a examination by inspecting the prostate through the rectum itself. This procedure is usually quick and painless, and they will be done with lots of lubrication to minimize the amount of discomfort that you will feel. I would basically then follow up with a repeat of the PSA and urine test to ensure that it remains elevated. The urine test basically shows that to prove that you do not have any ongoing infection other than the urine that can sometimes cause a PSA to be elevated. And then we will sit down and discuss the role of having a MRI prostate. The MRI prostate scan is basically something that has actually caught on in the last decade or so. As technology advances and our understanding of the prostate cancers improve, we found that MRI scan of the prostate basically it gives us a lot more information on the presence of cancers in the prostate. And the use of MRI prostate in recent years have actually caught on, in so much so that we are beginning to use a lot of MRI prostate to actually guide our biopsy. Finally, the part of the workup for elevated PSA would include a gold standard prostate biopsy. And what that means is that the gold standard way of really making sure that you do not have prostate cancer is to actually go into the prostate using a needle to get some tissue and to send it off to the lab to basically ensure that there is no presence of cancer in the prostate. And these biopsies nowadays are mostly done with image guided MRI prostates as well. With most other procedures in my series, the best way to describe a procedure would be a combination of pictures and drawing. So unfortunately for this topic, please bear with my drawing again, but I do find that over the years, drawing does actually help give a better impression to the patient to get to understand what's basically happening to them and what does each procedure involve. So prostate biopsy is the gold standard way of detecting and ensuring that your prostate do not have any cancer cells. Now, in the olden days, prostate cancer basically, I'm just going to draw a prostate here, is a random process. What it means is that the studies have shown an earlier part of the century is that to do a double sextant or 6 on each side biopsy in a random manner would be sufficient to basically find out whether you've got cancer or not. But let's say if you have a cancer that is very, very small but is actually not within the zone of your sampling, theoretically it is very possible to actually have a random sampling error. And basically what it means is that your biopsy did not hit where it's intended to hit. So therefore MRI is what's basically changed over the years. What MRI does in this sense is, instead of having a random process whereby you have no idea where the prostate cancer is, what happens right now is, through the use of scans, instead of telling you doing a random biopsy, it tells you areas in the prostate that is likely to contain prostate cancer. So instead of having a random 6-sided biopsy on each side, we do image guided targeted biopsy. All these targeted biopsy means, and what they mean is essentially is that we will focus more on this suspicious region, take more sample, and where then it's done, we will continue to do other sites as part of our template biopsies. Alright, in the olden days, biopsies of the prostate is done through the rectum, and that's basically what we call TRUS. It is a process that is actually still done in many parts of the world, but in Singapore, a lot of places has progressed beyond doing it from TRUS. Some of the reasons for that is because of the high infection risk that is associated with TRUS biopsy. TRUS biopsy means to do the prostate from the backside, and with that happens, you need to go through the rectum. The rectum, there is always a presence of feces, so the risk of getting infection can be fairly high, and up to 1 to 5% according to the literature, and these are very, very serious infection that we are talking about. So instead, what's changed in the last few years is that we've begun to actually do the biopsy via the skin, no longer through the rectum, in the olden days. In the olden days, there is a special probe that is fired through the rectum here. Okay, you get the sample in this way. Nowadays, we've decided that basically through the skin is a lot more safer. The risk of sepsis is a lot lower. It's a lot cleaner, safer for the patient, and therefore most places in the world has actually moved along to use image guided biopsy. That's number one. Usually done through the skin. That's number two, to reduce the overall cause of infection and have a better result. You will be given oral antibiotics depending on the type of prostate biopsy you choose, either through MRI guided, depending on which different machines, or if you really have to, you have to go through the old school way, which is through the rectum. Then oral antibiotics is a very important part of the preparation work before you go for the biopsy. Last but not least, prostate biopsy is actually a very short procedure. It can be done as part of a day surgery. You do not need to stay in hospital for that. There are some potential complications that can occur, which we would cover in the next slide. Some of the complications that can occur when you go through a prostate biopsy are repeating themes, but unfortunately all surgeries have a risk of bleeding and infection, and particularly because that we are dealing with the prostate this time around, some of the prostatic bleeding in this procedure can be fairly significant. What that actually means is that bleeding from the prostate can go into the bladder, and when you go and void after doing this procedure, you might actually find that there are lots of blood clots in your urine as you void it out, or the fact that the urine might actually be fully red in color, and that may persist for 2 or 3 voids. In certain rare cases, there are situations whereby clots starts to accumulate in the bladder, causing you to be unable to void because of that blockage of the urethra. In situation like this, we would basically need to do additional procedures to wash the bladder free from the clot. Because of the fact that we do this procedure via the skin instead of through the rectum like in the olden days, the chances of infection has significantly gone down over the years. Nevertheless, there is always a small chance that the skin provides a track to the prostate from the biopsy that was performed, and the risk of infection is ever present and something that you need to be aware of. If you have a big prostate with the biopsy that has been done, swelling occurs. In this situation, because of the fact that we can potentially take up to 20 to 30 different spots from the prostate, the overall prostate undergoes into a fairly significant amount of swelling, therefore causing the urethra to be narrowed from the entire biopsy process, and this can in times cause you to have urine retention that requires a indwelling catheter to be inserted temporarily, usually for 1 to 2 days, before you remove it out as an outpatient. Last but not least, complications of this procedure can be having blood in your sperm. Because of the track that we take from the skin all the way to the prostate, sometimes we might actually go through seminal vesicle. And seminal vesicle is an organ where sperm are temporarily stored before they are ejaculated, and blood can go through it, giving you the impression that you have very bloody sperm, a condition called hemospermia, or after a few days you might actually find that the ejaculate becomes dark chocolatey in color. These conditions can occur depending on how recent you have ejaculation after the biopsy procedure. It can either manifest as bright red or dark chocolate red.
Once a prostate biopsy is done, the results usually come back within 3 to 4 days, following which I will usually sit down with you to go through the cause of the rise in PSA in your case. It is important to remember that there are many benign causes of rises in PSA, like old age and big prostate, and not all of them is due to prostate cancer. And in the unfortunate event that indeed it is prostate cancer, I always tell my patients that prostate cancer, unlike other cancers, is usually very slow growing, and not all prostate cancers require treatment. And if discovered early, there are many ways of having a curative treatment for this condition as well. Last but not least, I would like to encourage all of you to leave comments to see what kind of topics that you would like to see in this channel, and remember to like and subscribe. Till the next time, bye!